appreciate the collaboration between IHEC and us. I have presented a few times already. We have a really interesting topic this morning with mislabeled THC products. So I do have a lot of information. I'm going to get started right away. So my name is Joe Eberstein. I'm a certified prevention specialist, director of community engagement for the Center for Community Research, which is a nonprofit that I work for. And I had the opportunity to manage the San Diego County Cannabis Public Health Initiative. Also an advisory board member for SAMHSA Region 9 and a member of the International Academy on the Science and Impact of Cannabis. It's important really to understand the region I'm in because usually we see the trends before they hit the rest of the country. San Diego region is home to about 3.2 million people, about 1.3 million in the city itself. We have a large border region with Mexico, lots of military bases, and lots of tourism. Our prevention system is made up of 6 regional prevention providers, which cover the entirety of the county. 3 substance use initiatives, which cover a variety of substances, including alcohol, cannabis, opioids, meth, and fentanyl. We have a countywide media program, evaluation, and Friday Night Live. The strategies that we use in our work, of course, is primary prevention, which is what I mostly do for kids in schools. I am a big backer of curriculums in schools that talk about healthy coping. We do secondary prevention, early detection of use to support interventions. I'm also a big backer of traditional treatment, harm reduction strategies, and education throughout, especially when it comes to cannabis. The Cannabis Public Health Initiative advocates for primary prevention, data-driven public health messaging regarding cannabis harms. We support smoke-free policies, although we're starting to see consumption lounges coming into our county. We're going to get the first marijuana consumption lounge this month or next, and then growing the prevention field as a viable career. We're lucky to have a lot of experts on our key leadership team. The experts come from a variety of sectors, including toxicology, research, medical, doctors, and law enforcement and treatment. So you can go and visit our website, and I'll give you the URL at the end. So let's jump right in. Addiction for profit industries, including alcohol, tobacco, pretty much use the same tactics. They focus on getting a certain number of frequent users to buy their product. They use colorful packaging and sweet flavors to entice younger consumers, and they continue to increase potency levels. They also promise the black market will go away and public health issues will be minimal. We've seen this with the alcohol industry, tobacco industry, and now with the cannabis industry and vaping industries. Before we get started, we cannot speak enough about the power of the cannabis industry right now and how much tax revenue it's bringing into different states and counties. Just in California alone, in 2023, the generated tax revenue from cannabis sales was $1.8 billion. In 2022, it was 1.1, and 21, 1.4. Lots of counties, including my own, have budget deficits, and they're looking to grow the cannabis industry. Now, unfortunately, what isn't talked about often are what's happening in terms of the black market and these products getting into people's hands that are not regulated and mislabeled. So the illegal cannabis sales still outpace legal ones in the state of California. Experts struggle to tell legal products from illegal cannabis products. Black market marijuana contains banned pesticides, mold, and contaminants. And we still have criminal networks destroying our forests and open lands here in California with illegal grows. So everyone seems to be selling these hemp-derived products. Why are they doing that? Well, in states where cannabis is illegal, this is a gray area which is difficult to enforce. The only way really to tell a hemp product from a cannabis THC Delta 9 product is to actually get in and study the chemical components. In states where cannabis is recreationally legal, you don't have an expensive cannabis license to get. So there's ways around getting an expensive license, and that is by selling hemp. There's also no age restriction on hemp. Hemp is not regulated, and therefore there's no age limit for sales. The passage of the 2018 Farm Bill created a legal loophole to sell these chemicals. For those of you that aren't familiar with the 2018 Farm Bill, was signed into law, and it removed hemp defined as cannabis sativa and derivatives of cannabis with extremely low concentrations of the psychoactive compound Delta 9, THC, which they removed from the Controlled Substance Act. Manufacturers can synthesize hemp-derived chemicals to produce intoxicating compounds. And these products are generally sold without regulatory measures or safeguards to protect consumers. Some states have taken action. In California, the governor has banned hemp-derived products with any amount of THC. The new rule bans consumable hemp products with any detectable amount of THC, the compound primarily responsible for the psychoactive effects of marijuana. In Illinois, there was an attempt at banning these hemp-derived chemicals, but it failed. So now there's this gray area that's probably competing with the legal market for sales. So what are these chemicals? Who's producing them? Where are they coming from? Well, there's dozens of hemp-derived chemicals that are coming out every day. Here's one called THCP. An Italian researcher who discovered THCP found in experiments on human cells that THCP binds 33 times more effectively with the CB1 receptor than Delta 9, substantially increasing the psychoactivity. There's Delta 10, HHC, THCP, THCO. So we were very concerned with this here in the San Diego prevention system. And we, as a prevention community, decided to do some investigatory work around who's selling these products. And what prompted the investigation into these products were community concerns, local prevention groups, and there were a few medical incidents at local hospitals. We did environmental scans of these businesses. We do environmental scans of alcohol businesses. We do environmental scans of dispensaries and smoke shops. And what we look for in these scans are security, whether they have cameras, whether they have an armed security person. Is there minor access? Are they checking IDs? What products are they selling? What type of advertising? Lighting, parking, and proximity to youth-sensitive location. So the sheriff actually got involved, and their toxicology lab did, once these items were purchased by the marijuana enforcement team at local smoke shops and gas stations. They actually notified retailers of the products they were selling and told them that they're responsible for these products. Many of the products tested contained illegal substances, including psilocybin, which is illegal here in the state of California. I want to give a shout out to our sheriff's department for holding this press conference because they got all of the experts together. They work with alcohol and beverage control, and they're continuing to work with them to notify them of these substances. So I want to show you this media piece, which gives a pretty good overview of what the press conference showed.
Today, the San Diego Sheriff's Office issued a warning today over mislabeled THC products that are deceptively marketed to children.
This is very concerning here. The warning says that some food products, such as candy, cookies, and brownies that claim to have little or no THC, actually contain high levels of the drug. CBS 8's Kelly Hessedal joining us live from the Sheriff's Technology Center with the latest on this. They're concerned about it. I know parents are concerned about this, Kelly.
Yeah, absolutely. So THC is what's in cannabis that gives people that high feeling. But these products were tested by the Sheriff's Office Crime Lab. If you take a look right here, you can see how colorful some of these products are. They found high levels of the chemical. We heard from a doctor today with Radies who's been researching this stuff for a long time. And she says they're seeing more and more kids come into the hospital after accidentally ingesting THC.
Right? Why are young children doing this? One, the products look like candy and food that they see in their everyday lives. And two, products that are labeled as safe, right, that they're mislabeled, parents are leaving out because they don't think there's any intoxicating component to it, and the children are getting into it and becoming very, very sick.
And that was Dr. Natalie Lobb with Rady Children's Hospital. Now, she says the average age they're seeing of kids in the hospital who accidentally ingest THC is 3 years old. Now, you can see the products are in this bright packaging that could easily grab a child's attention. As she says, there is no amount of THC that is safe for a child, that even a small amount can be deadly. Now, when it comes to teens, she says the fastest growing group of teens using cannabis is girls in the age range of 11 to 13 years old, and some are ending up in the ER. Now, there's also this concern that an adult could ingest these products and then get behind the wheel without realizing they could be at risk for driving under the influence. So these things are sold at gas stations, smoke shops, convenience stores, even some major retail stores. There is so much concern over all of this that last month the state of California recently enacted emergency state regulations. So back out here live, the Sheriff's Office is sending out letters to businesses reminding them that they are legally responsible for the products that they sell, and some business owners could potentially face felony charges if they knowingly sell products that are misleading to the public. Kelly Hessedal, CBS 8.
So many products that claim to be hemp-derived are being sold that contain harmful levels of tetrahydrocannabinol. Now, I know in the state of California, the only ones allowed to be selling THC or CBD are licensed retailers. So any other place that's selling those products are not abiding by the law. The main active ingredient in cannabis that can cause a high, which is Delta-9. Misleading packaging, products claiming to be hemp-derived can look like everyday candy and snacks. Some products claim to have less than 0.3% THC, yet contain significantly higher levels. And the products sold in convenience stores or online are not required to go through the traditional consumer protection evaluations or safety reviews. Here's a breakdown of the products that were actually bought. 113 items the sheriff tested. They were papers, cookies, resins, lollipops, brown, powdery, solid, candy bar, liquid, vape pen, and gummy. They were purchased at smoke shops and gas stations. The gummies, 50% contained THC when they said they didn't have any THC. Other substances that were found were Delta-8, psychedelics, and illegals, and you can see a breakdown of the chemicals here. Now, of the vape pens that they found, 68% contained Delta-8 THC and 21% contained nicotine. Again, these were mislabeled products that either said they had Delta-8 or no THC in them at all. So this is not just a California or Illinois issue, it's actually a national issue. There have been other studies about these products. Of the products tested in this study, 77% had less Delta-8 than was advertised. Some had more. It's very difficult to determine the health risks when the label doesn't match what the ingredients are. And there's no product integrity. 76% actually contain more than 0.3% Delta-9, which means the products available online and at gas stations are indisputably federally illegal. There's also a problem with mislabeled CBD products. Now, the only CBD that is actually FDA approved is from Epidiolex, and that is an anti-seizure medicine. The only THC that's regulated is from dronabinol, nabilone, and other THC medications. Here's a study that showed products were mislabeled with 26 containing less CBD than labeled and 43% containing more. So unless you are a licensed cannabis business by the state, you are not permitted to sell THC or CBD. It's amazing to me. I walk into my gym and I see CBD gummies, and I don't know how they get away with selling those. They're not a licensed cannabis business. Why should we be concerned? Well, unknown ingredients and no product integrity. There's no manufacturer listed to actually take legal recourse. There's no warnings, unknown health risks. Impaired driving isn't always an issue. Is the product I'm using intoxicating? How long will it take for the impairment to start, and when will it be over? The FDA was concerned. They put out a warning about Delta 8. And this is a really interesting report, which anybody can analyze. It's got some great information about the effects of Delta 8. We did start to see from national poison centers that Delta 8 poisonings actually peaked in 2022 and in 2023. They seem to be going down now. I'm glad that we're tracking these numbers because we don't know how much of Delta 9 is causing these exposure cases or Delta 8. And I think if the cannabis industry is going to grow, they need to get a handle on these other markets because they're giving them a black eye with these cannabis products. Some of the products had no labeling at all, which is very problematic, like this lollipop. There were lollipops in some of these stores that had a significant amount of THC, Delta 8, or psilocybin. Anybody could pick up this lollipop and just think it was a regular lollipop. So the sheriff here is taking other actions. If you actually want to report a business, you can, or if you want to get rid of these suspicious products, you can drop them off. Again, they were purchased at gas stations, smoke shops, and markets. There's no age restriction on these products either. What I alluded to earlier with a growing concern are 11 to 13-year-old girls, and I wanted to talk about this specifically because there's going to be a national study coming out about this trend. Our young females, 11 to 13, are actually starting to beat males out with their cannabis use. Adolescents who met the diagnosis for cannabis use disorder or used the drug recreationally had a higher prevalence of depression and suicidal ideation than those who didn't use cannabis. And you can see here for major depressive disorder and suicidal ideation. Now, this new study is going to be looking at national ER data. There are more female patients than male patients every year, except in 2018, diagnosed with cannabis use disorder. The primary insurance payer for these individuals is public insurance. I don't know why they noted that, but they did. And since 2020, females now outnumber. The predominant race is white, non-Hispanic, and they're visiting the ER for a number of reasons, including suicidal ideation, self-harm behavior, anxiety disorder, depression, and a history of sexual abuse. When we look at our medical examiner data regarding adolescents younger than 25 who committed suicide, we see an alarming trend, and that is that the presence of THC is the highest among these adolescents that committed suicide in our county. And this is not just in 2023, but this was a trend in 22 and 21. You'll see that THC presence actually was higher than alcohol presence in completed teen suicide. Now, the method for suicide among the THC users was hanging and jumping. Now, the reason I bring this up is not to be morbid, but to maybe point to some sort of psychosis or jumping or running away from somebody or something, having a delusion. I do want to talk a little bit about vape pens because there is some action on vape pens. As everyone knows, the predominant way young people are using cannabis is through vapes. Now, the FDA has not regulated e-cigarettes until 2016, and even then, they've done a very poor job. The FDA estimates that e-vapor category grew by approximately 30% in 24, and that the illicit products represent more than 60%. Now, there's a trend taking over with these Chinese vapes. They're disposable nicotine vape with an LCD display that can be connected to a smartphone via Bluetooth. The vapes look more like a cell phone from the early 2000s. It allows users to customize the screen background and see how many puffs of nicotine are left. The combination of technology and vaping is problematic. There are other vapes that are very popular as well, these squishy ones, unknown ingredients that are coming from China. They're not using pharmaceutical grade nicotine or additives, and there's poor quality ingredients. The vapes are colorful and come in eye-catching metallic finishes, textures, squishy textures, and rounded shapes. What sets them apart again are the LCD screens, which are harmful to the environment. We have a city here locally that just banned disguised vapes. Now, if you look at this vape, it looks exactly like a pen. So I think the city of El Cajon was the first in the nation to ban these. But you wouldn't be able to tell this vape pen from an actual pen. So I'm glad the city took some action. Another question that I get a lot is, are we seeing fentanyl in the cannabis supply? And I can say, checking with the DEA, that we have not seen fentanyl in the cannabis supply. At least none of the local labs are reporting that marijuana is being laced with fentanyl. Now, we did have a confirmed case in 2019 of a vape pen containing fentanyl. And how do we know this? Because it was actually confirmed by the medical examiner and the DEA when they took apart the vape pen. Now, I'm always getting asked to send media stories about vape pens with fentanyl, but I always wait for the confirmatory evidence because I don't want to start a public health crisis by putting this out. I think if we were seeing significant amounts of fentanyl in the cannabis supply, we would have a lot more overdoses. And I'm happy to say that our county is finally seeing a significant reduction in fentanyl overdoses this past year. So that's some good news. I do want to go over some resources from our initiative because it's important to stay on top of these issues. A really excellent study came out here regarding secondhand marijuana exposure. I get asked the question a lot too. If I'm around people who smoke cannabis, will I come up with detectable levels of THC? And the answer is yes. This study used at-home monitors to check the air quality, and 357 San Diego families signed up to be in this study, and actually allowed researchers to take urine samples of their children. So these kids came up with detectable THC biomarkers in their urine when they were exposed to parents who smoked. This is very important because we are going to get consumption lounges, and there's always concerns for workers who work in those environments. People ask me too, what are we seeing in terms of youth cannabis data? You know, is it all bad news? And actually it isn't when we look at our 12 to 18-year-olds. Alcohol use is going down amongst this group. Cannabis use has gone down, and this isn't just California data. This is monitoring the future data as well, which is national. Tobacco use has gone down. But one thing that has gone up is vaping. The highest year ever recorded for vaping among kids was 2019, somewhat leveled off around COVID. We recently started tracking cannabis vaping, so we only have one cycle of data from our California Healthy Kids survey. Another concern that we see is drug interactions. We are seeing young people sort of trying to help their older relatives with medical conditions by recommending CBD or THC. This can lead to drug interactions. There's a major drug interaction between CBD and blood thinners. So you really don't want to recommend to your grandparents, if they're on blood thinners, to be using CBD. THC has drug interactions with several mental health medications and seizure medications. So visit drugs.com if you'd like to check and see. If you haven't heard about this group, the International Academy on the Science and Impact of Cannabis, you probably want to join their listserv. It's a non-political group of doctors that are advocating for smart medical science and some of our policies regarding cannabis. There are doctors that represent several states and several areas of medicine. It's isaac1.org. They have a great medical library that speaks about the harms associated with cannabis on different parts of the body and what several medical associations say about medicinal cannabis. We also have a medical library at our ccrconsulting.org website. I'm very proud of this because it continues to grow. And we are adding a whole section on secondhand cannabis smoking. We were tasked by the county to develop public health signage for cannabis businesses. This sign will be in our dispensaries. I'm not sure what Illinois does or what they have in terms, but one of the items that's stated is bud tenders are not trained to provide medical guidance about cannabis use. So when you do go to some of these places, you'll see somebody in a white coat, and generally they have no medical background to be saying that these products can help with any medical condition. And actually, that's illegal in our state. You'll notice that most of these bullet points are pertaining to mental well-being or brain health, because that's a major concern. There's lots of studies coming out now about psychosis and schizophrenia related to cannabis use disorder and what that does specifically for adolescents. Always safely store your cannabis products away from children, because that's another trend that we're seeing. Our kids getting into the parents' edibles. Edibles look exactly like a cookie or a candy, specifically when it's taken out of the wrapper. We had the pleasure of doing an ABC 10 series with Jim Avila regarding the dangers of marijuana for children, and I'm going to send this over to Annabelle so you can click on the links. This was a series that went from January 15th to February 15th that talked about edibles and poisonings, mental health issues, and advertising. And I will tell you, I don't know if you're familiar with Jim Avila. He used to be the White House correspondent under the Obama administration. He's been in the media world for many years. He was on, I believe, 60 Minutes. And he said in his 50-year career that this was the hardest story to ever get out because of the threat of legal action from the cannabis industry. As soon as the first part got out, the phone calls started to ABC with the threats of legal action from the cannabis industry. So I want to applaud him for being able to finish the series. Because we spoke about intoxicating chemicals, I want to talk about this resource, which comes from the Transportation Research and Education for Driving Safety over at UCSD. They've been able to put out some really easy to use driver safety materials. Treads, as they're known, has a 40-minute self-paced course on driver safety. They not only talk about alcohol, but cannabis use and DUI laws. And again, you can watch the preview or access the course. This is all free, by the way. So these resources also are in English and Spanish. So they're easy to use and they're accessible. So I advise everybody, if you have that age group that's learning how to drive, getting their license 18 and older, that they go and watch the course. They also have these amazing tip cards, which are in English and Spanish. And they talk about safe driving windows. When inhaling cannabis, wait at least 4 hours to drive. When eating, wait at least 8 to 10 hours to drive, and individuals should not drive until the effects of the drug are no longer felt. They talk about the penalties of first-time DUI. I believe it was somewhere in the area of $13,000 in legal fees and lawyers' fees. Again, it's important to give the full picture when we're trying to educate our young people about the risks. We should also have 0 DUIs at this point with all the rideshare programs that we have. We are constantly encouraging our young people to use rideshare programs. We just did a teen safe driving forum with Mothers Against Drunk Driving and Treads, because we know prom and grad season are coming up. By the way, our highest fatality rate year that we ever had was 2021 during COVID, when everybody was told to stay home. We support the Red Ribbon Campaign. We actually hold a luncheon here in San Diego, and we have the family of the DEA agent, Kiki Camarena, that attends, and that's on our website as well. We do work with a younger group than the college students. We also work with college students. We're starting a program with Elevate Youth California to work with local colleges, sort of a mentorship program. We also have active social media, and again, I am 53 years old, so I am not a big fan of social media, but I do know that there are benefits to using social media. A couple of things that I learned from using social media: that you must interact with people. It doesn't mean that you have to get into arguments with people, but if you like and share other people's materials, it will actually benefit your channel. Again, it's a good way to do 3 things: to show data, to get people to your events, and to recruit. So that's really what I use it for. I don't really use it for any other things, as I said, debates or anything. So we have an active YouTube page, Facebook, Instagram, X, and our CCR website. We recently redid our CPHI website to include our public health resource library on cannabis harms. I'm always called into question about the science, and am I being too hard on the cannabis industry, or, just read the science. This is stuff that you're probably not getting on Google, at least in the first couple of searches that you do. We have current projects. We did a project with pharmacies about drug interactions, where we actually handed out 12,000 info cards at 16 local pharmacies to let them know about drug interactions. And what we found in our survey was that most people want to know about drug interactions, and that 50% admitted to using cannabis on a regular basis. So they thought it was very useful information to know whether their over-the-counter medications were affecting the CBD or THC they were using were affecting over-the-counter medications. This is our CCR website. So CPHI is an initiative under CCR. We also have the Substance Use and Overdose Prevention Task Force, countywide media, and the Red Ribbon Campaign. We put out a report card about our overdoses with fentanyl. And since fentanyl is the probably the worst thing that's happening here in substances. I can tell you that we had our highest fentanyl deaths in 2022, I believe, 1,305 overdoses. In 2024, that number was down to 1,204. Still, that's way too much. Because in 2015, we had about 500. So we did start to see a massive trend where our fentanyl overdoses more than doubled. Thankfully, that's stopping. I know it's 9:36 and we have a lot of time for questions, but I do want to give my email, jeberstein@ccrconsulting.org. I'm going to share the presentation with Annabelle, and you can click on the links. Especially, I would advise to click on the ABC 10 links. There are some great resources in that media, and there's a lot of personal stories. There's one or two personal stories where their children had the same exact trajectory, mental health wise, as each other, and they never met before. And they both admitted to using high amounts of THC in vape pens, and no other substances were found. So I am going to stop sharing. And see if there's any questions that anybody has. We have a small group, so please feel free to ask me any questions or let me know what you're seeing in Illinois, if it's different. In Illinois, do you have smoke shops? Anyone?
I believe that there are a few. Ryan, do you know of any that have been on you or Ryan's radars? Ryan used to be at Eastern a couple years ago.
Yeah,
Worked as a police officer, and now he's up at, oh no, Mike wouldn't have that.
I think his mic is off.
But yeah, but he has more of that, you know, the drug recognition training and things like that. So he
Right. Yeah, what's amazing is I'm on week 7 as an Illinois resident impression, but I'm not ready to speak. Okay. Yeah. Well, I have to tell you, I was surprised because I'm from New York, and when I moved here, I saw these smoke shops and I didn't know what they were because we don't have a lot of them at least when I was growing up there. But they sell drug paraphernalia. They were selling meth pipes. And then all of a sudden we started to see these psychedelics, which we didn't know what was in them. So our prevention group went in and purchased these and found out that psilocybin was in some of them. Methamphetamine was in one sample. So actually, it's uncharted territory in some of these smoke shops. And the thing is, there's no regulation on smoke shops. So you can be young and go in there and purchase these. And they're colorful packaging, and you don't know what the health risks are with these. So I would advise people to go in, and if you have a toxicology lab or work with the local PD, to get some of these tested to see what's in these products. On the campus of the university, we have approximately 10 to 15. Wow, that's amazing. Within walking distance. Yeah, products that stated that they had no THC actually had high amounts of THC in there. So they're breaking state law as well as federal law in doing that.
looks like we had a question.
Oh, no smoke shops are not dispensaries. We do have 4 dispensaries on or near campus. Yeah, it's very ironic that they set up shop around campus. I mean, you know, we're going to see a lot more in the county of San Diego, as I said, where our budget is not doing well. So they're going to expand the market, unfortunately, and consumption lounges. Is that becoming a thing in Illinois at all?
I've heard about it, but I don't know what the scope of that is yet.
Yeah, we have a 16,000 square foot facility going in where you can, it used to be a college, ironically. So they're turning colleges into consumption lounges. And they have a rooftop patio where you can consume. You can actually eat edibles there and store them on the premise. And then it's right next to the 5 freeway, so we don't know how these people are gonna get home. I don't know.
Do you know anything about the legality of that? Like, how are they able to do
Yeah.
that knowing full well,
Yeah.
what, potential implications?
Well, the governor passed, I forget what the legislation was, but he basically made these places legal in the state of California. And now you are allowed to serve food and have entertainment there as well. Before that wasn't allowed. So the governor actually did that again, hoping to enhance the budget with growing the cannabis industry. Yeah,
Unfortunate.
it's really a shame because a lot of our tobacco policies are being torn down. And a lot of people work very hard on those. I have to tell you, I grew up in a smoker's household and I have asthma. I don't like eating when people are smoking. And I'm really sad to see some of these policies go away. So I don't know
Oh.
what the answer is. Any other questions? Annabelle, I know this went early. I'm sorry.
Oh, no, you're fine.
But, again, you can reach out to me